Tonight, a deeper look into our TV6 investigation about the contraceptive Essure. Last week, we brought you the stories of 3 women with unexplained pain and symptoms. They believe Essure is to blame. Tonight, in part 2 of the series, doctors say Essure can still be considered a safe device when used correctly. As KWQC's Amber O'Brien reports, another woman in the QCA deals with a rare problem with the device.
I jokingly told a coworker if I didn't know any better, I would think I was pregnant.
Ellen Hanrahan got on Essure to prevent pregnancy. She was in her 30s and using birth control pills. Her doctor recommended something more permanent.
I was approaching age 35. My doctor recommended I quit using birth control pills and look into maybe a more permanent method of sterilization.
One of the most familiar ways to do this is through tubal sterilization, or getting your tubes tied. But in recent years, a new popular device called Essure has hit the market.
So we kind of reviewed all of our different options, and she presented this Essure product as minimally invasive, easy to recover.
For Ellen, it was a good and final option.
She said to me, it's permanent, it's irreversible, make sure that you're sure that you're done having children. So that's why we chose to get that.
The Essure device is a pair of metal coils designed to be inserted or implanted into a woman's fallopian tubes. After several months, scar tissue builds up around the coils and then creates barriers to prevent pregnancy. Bayer markets the product as a simple, minimally invasive procedure that doesn't require any recovery time. And according to a doctor we spoke to, all of that is true.
You can walk in as an outpatient and have Essure done and conceivably even go back to work the same day. There's no incision involved. It's done through a hysteroscope where micro inserts are placed in each tube.
Local OBGYN Jeff Morris says the Essure device has particular advantages, and in some cases he may recommend it in place of tubal sterilization. But those who want the device installed do have to jump through some hoops to get it.
The Essure procedure is a little more complicated. However, in many ways simpler. You have to use birth control for 3 more months. You have to go through a procedure to make sure your tubes are blocked 3 months afterwards.
And Ellen followed all of the steps.
And I had the HSG dye study done, which confirmed that they were in the correct place and that my tubes were blocked.
Her doctor confirmed she was sterile.
The brochure that I had read before I got it said that there's been 0 pregnancies in 5 years of clinical studies, 99.83% effective. You know, everybody says pregnancy is not possible if you follow the guidelines.
Ellen didn't have the symptoms like the other women we first mentioned last week, like extreme fatigue, pelvic pain, or migraines. As far as she knew, Essure was working.
The procedure for me was easy, recovery was easy. I didn't notice anything was wrong until about a little over a year later. I was extremely tired, exhausted, so I thought maybe I was just worn out.
Instead,
before I decided to go to a doctor, I did actually take a home test, sort of to rule it out, and then I would go. Except it didn't rule it out, it was positive.
Ellen was 10 weeks along with a baby girl.
I can still think of the feelings now, just how shocking it was for both me and my husband.
Ellen explains at that time no one was concerned about how it happened because no one was sure. What they were worried about, the 10-week-old developing normally. Dr. Morris tells us anytime a woman gets pregnant after permanent sterilization, it's dangerous.
When pregnancies do happen after either of these procedures, there has to be great concern.
But for Ellen, the concern was the lack of information.
There is no research at all on the health of the mother or the baby and what the coils may do. Could they be somewhere in the body that could affect the pregnancy?
She suffered many scares and health issues during her pregnancy with her daughter.
It was quite a rocky road, actually. I screened positive for 1 in 83 chance of Down syndrome.
Ellen was also 37 at the time. Finally, baby Lena was delivered healthy.
She's a blessing, absolutely one we never would have thought.
Doctors say the chances of getting pregnant while on Essure are very small.
The failure rate is very, very low, way less than 1%.
Over 750,000 women nationwide rely on Essure. However, according to Essure's 99.83% success rate, over 1,300 women could be or could become pregnant.
These things are very rare and I don't think should dissuade women who want permanent sterilization to do them. But like any operation, there can be complications and they can be serious.
But it's important to do your research before picking a birth control or sterilization. Talk to your doctor.
Properly informed consent is, as with any operation, you want to talk about benefits, risks, alternatives.
In Davenport, Amber O'Brien, KWQC, TV6 News.
2 weeks ago, one of the women dealing with Essure in the QCA and a dozen others rallied in Washington, D.C., fighting to raise awareness about it. Other local women have contacted a state representative to plead their cases. They are hoping to get the device off the market and to dissuade anyone from choosing Essure as birth control.